This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Chris Hedio, health coach, Mon Health Heart and Vascular Center, as well as Lynne Withrow, Senior Nursing Director at the Heart and Vascular Service Line. Good morning, guys.
Good morning.
Hey, thanks for joining us today. We're going to talk about the Morgantown Heart Walk on the show this morning. But as we always do, before we jump into the topic of the day, we'll get to know our guests just a little bit better. Chris, I know you're an old veteran of being on the show, but so you know the routine. I don't even have to tell you. Tell us about your background and a little bit about yourself.
So I'm a native of Fairmont. Graduated from Fairmont State University with my undergrad, went to postgrad in Atlanta, Georgia. I've been working at Mon now for almost 4 years.
And let me see if I can think of something I haven't asked you in the past. I probably asked you this, but what drew you to this career?
The family-oriented atmosphere and, of course, just helping people out and making them feel, better about themselves and better in general.
All right. And Mary Lynn, is this your first time on Mon Health Talk?
Yes, Dave, this is my first time.
Oh, we get to grill you with questions then. All right, Mary Lynn, tell us about your background. Where are you from? Where'd you go to school? How did you end up getting connected with Mon Health?
Well, I grew up in McHenry, Maryland. I went to my undergrad in nursing at Alderson Broaddus University, and then received my master's at WVU. I've been with Mon Health for 6 years, but I've been a nurse for 40 years, and I've been in cardiac processes probably for about 26 years.
What drew you to nursing? How did you choose this career path?
Well, I started in nursing because I wanted to make a difference. I wanted to give back to those around me in my community. And also I had a grandmother who lived with us and had a lot of disease processes, and my family took care of her. And so I always wanted to be a nurse.
And Chris, when I introduced you, I said you are a health coach with Mon Health Heart and Vascular Center. What does that entail? What kind of services do you provide?
So I look at each individual patient, their nutritional habits, their exercise habits, their stress level, including with everything going on, with their heart health, diabetes, anything else that goes with that, and try to rebuild their lifestyle so that they continue to stay healthy and live a long and happy life.
You're a coach. You're the guy who provides the encouragement and maybe, if needed, a little bit of chastisement if needed there.
I try not to do that, but occasionally.
Yeah, occasionally you probably got to go look at him and go, all right, you had a couple extra cheeseburgers this week. I'm just throwing something out there, Chris.
Yeah.
But how did that kind of service evolve? Because generally you think, okay, if I'm a cardiac patient, I've had heart procedures, or I'm trying to improve my overall cardiac health, you think about doctors, you think about going to the cardiologist, your primary care physician. So how did the health coach position and the service you provide, how did that kind of evolve and become part of the team?
Well, you said it best. You think about going to your doctors and everything, of that nature, but the problem is outside of that, you can go to your doctor and get your medications looked at, and it can tell you, you need to eat better, less sodium, lose a little bit of weight, and then you go on your way. So the idea behind health coaching is that I would continually follow you and make sure that you're keeping track of yourself and staying accountable every day of the year, not just when you go see your doctors.
And that could be a tough change for folks who maybe ate a certain way or were not eating nutritionally sound, or that can be quite a transition to suddenly have to say to lay off maybe foods they really liked, or change the way they eat, or change the way they think about the way they eat. And that encouragement sounds like it could certainly make the difference.
It is, and it does.
Chris Hedio is our guest this morning, a health coach, Mon Health Heart and Vascular Center. Lynne Withrow, a senior nursing director, Heart and Vascular Service Line. The Morgantown Heart Walk is quickly approaching. Lynne, when, where, when does it all take place?
The Heart Walk will be June 17th at the Milan Aquatic Center. It will start, registration starts at 9:30 and the walk begins at 10 o'clock.
What's the purpose of the event, Lynne?
The purpose of the event is to bring awareness of heart disease. Heart disease is the number one killer of women and men, and 1 in every 31 second makes a difference in people's lives, and one person dies every 33 seconds with heart disease in the United States. So getting that awareness out there is extremely important.
And Chris, back to you. Mary threw out a couple of the statistics there. We probably have been directly, maybe people listening are cardiac patients, but they're likely to have someone very, very close to them who has had to deal with these kinds of heart issues.
Oh, yeah, for sure. You know, even myself, I have a parent that has heart issues. In-laws have heart issues. It's kind of unbelievable. You talk to many people just out on the street that a family member or someone close to them has had a heart problem. A lot of times you're shocked to find out even themselves, at a young age and things, people have heart issues.
Talking to Chris Hedio this morning and Lynne Withrow, and we're going to be talking about the Morgantown Heart Walk. We'll get you more specifics on that, but we got to take a break right now. More Mon Health Talk coming up on the other side of this timeout. Back after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Chris Hedio, health coach, Mon Health Heart and Vascular Center. Lynne Withrow, senior nursing director, Heart and Vascular Service Line, talking about the Morgantown Health Walk. And guys, thanks for joining us this morning. Lynne, what will the Heart Walk be raising money for this year?
The Heart Walk is for the American Heart Association, and the American Heart Association uses those funds to educate the community as well as doing research to improve the lives of those individuals who have heart disease.
And Chris, as far as the event goes, do you have to register as a team? Can you register as an individual? How do you get signed up for it?
So you can register as an individual. You can register on a team. There is pre-registration available at the website, and also you can register the morning of.
And is there a fundraising minimum?
There is no fundraising minimum. You can just join a team and show up as a participant, showing solidarity for heart health, although donation would be nice.
And as far as the teams go, how has turnout been in the past? This is a pretty popular event.
Yes, last year there were lots of teams that came to the Heart Walk. Everybody had a really great time. There was music. There was face painting for children. We do blood pressures. Lots of different things occur at the Heart Walk.
Yeah, I wanted to ask about that, Lynne. There's obviously the walk that is I guess that would be the main event, but there are a lot of other things happening around it, and you kind of touched on a couple of those. Can you give me an idea? This is an event, so there's a lot more than just, you show up, you walk, you leave. There's a lot of things going on. Can you give us a little bit more of a preview of what else might be happening?
Sure. We will be doing, like I said, blood pressure screenings. We also do hands or CPR demonstrations, and there's a lot of different folks who come to the Heart Walk, and they share information with the participants.
Hey, Chris, here's a question I probably should ask. How far is the Heart Walk?
So the track itself is a 1/4 mile around, but it really is up to each individual participant or their team. Their team may have a goal of, hey, we want to walk 2 miles for heart health. Some people walk the entire time. And then, of course, it's up to your ability. So some people may walk, 1 or 2 laps and say that's about enough, and then hang out at the area where the tables are.
So what's the time frame again for the Heart Walk?
Registration starts at 9:30, and the walk begins at 10 o'clock.
I was just trying to think how many laps you could get in, Chris, if you walked the entire time. You could really cover some mileage there.
Yes, you can.
Hey, how does, Chris, I'll toss this to you. How does Mon Health support the Heart Walk?
So we have several teams. A lot of departments at the hospital here have their individual teams. But then we're also recognized as one of the top sponsors for the Heart Walk.
How many teams do you usually put out there for the Heart Walk?
About 14.
Oh, wow. 14?
Mm-hmm.
And I imagine, Chris, you're on one of those teams?
I am. I'm the coach of the team for the Heart and Vascular Center.
That only makes sense, Chris, that you'd be the coach for the team. Mary Lynn, have you participated in the Heart Walk? You going to participate this year?
Yes, I'm going to participate, and I also have a team, and my team is called My Heart Goes On.
Nice. I like it. Chris, do you have a team name? Do you have a nickname?
Yeah, we are the HVC Arbs of Steel.
I see what you guys are doing there. Very well done. Very well done. We'll continue our conversation more with Chris Hedio, health coach at Mon Health Heart and Vascular Center, and Lynne Withrow, Senior Nursing Director, Heart and Vascular Service Line. It's Mon Health Talk. We'll continue in a moment on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Mon Health continues this morning. Chris Hedio, health coach, Mon Health Heart and Vascular Center. Lynne Withrow, Senior Nursing Director, Heart and Vascular Service Line. We're talking about the Morgantown Heart Walk this morning. Chris, why is it important for people to walk for their heart health?
There's a number of reasons, Dave. There's lower blood pressure, lower blood sugars, decreased heart rate. It also can help with weight reduction and bone health, bone density, also longevity.
I'll ask both of you, and I'll start with Mary Lynn. Mary Lynn, what are some tips for being heart healthy?
Some tips would be to watch your sodium, exercise 3 to 5 times a day or a week, and be mindful of your sedentary lifestyle. Get up and be active.
Yeah, it's summertime. We've got options. We can get outside. We can do a lot of things. And Chris, so often on this show, in fact, I think just about every Monday, at some point, we will mention watch what you eat, exercise, don't smoke or quit smoking, and that will have those 3 steps will have a tremendous impact on improving your overall health, including your heart health.
Yeah, that's right. Watching what you eat, like Mary Lynn said, with your sodium, watch your saturated fat intake. You don't want to get too much of that. Smoking decreases the size of your blood vessels and makes your heart have to work harder than it needs to. So trying to decrease the amount you're smoking and quit altogether would be great.
Hey Chris, people often hear, and especially older adults, probably hear exercise, and they think, oh, man, I don't want to get a gym membership. I've moved past that point in life of running wind sprints and doing, long distance running or whatever the case may be. What are some exercises that could be enjoyable, but also B, it doesn't necessarily mean you have to go spend 2 hours in the weight room or 2 hours on the treadmill, does it, when we talk about getting exercise?
No, absolutely not. Walking is great. It's the cheapest and easiest thing you can do. Now is the time of year to really get out, with our rail trail system around here. The botanical gardens are close by. Here at Mon Health, I even lead a free walking group at Mountaineer Mall every Monday and Wednesday at 10.
And Mary Lynn, I'll toss this out there as well. I think pets can be a big help because, if you've got a pup at home, the dog needs to be walking. It's a good excuse. They kind of make you get out and go for a walk every day.
Absolutely, David, and they're a good motivator, as Chris would say.
How do they motivate folks, Chris?
Well, when they want to get moving, you really have zero choice to move around with them, unless you have a really nice fenced-in yard, but you still got to corral them eventually.
Is there a correlation there? I kind of thought there was, Chris, but do you see a correlation there between folks who it doesn't have to just be a dog, but have pets that kind of make them get out, move around a little bit, get that exercise without knowing it?
Yeah, animals want you to move around. They want you to play with them, things like that. And, of course, just many studies have shown that having a pet in general decreases your stress, which decreases your cortisol levels and brings down your heart rate, your blood pressure, all of that.
Hey, and we're quickly running out of time, but you've mentioned stress a couple of times, Chris. It's one of those deals that I don't know that you can put a number on it. I don't know if you can quantify it, but it's certainly a major factor in heart health.
Oh, yeah, it's a huge factor. Like I said, your body transitions into certain hormone profiles when you're stressed out. The problem with it is they have a negative impact on your body. So taking time to relax, have fun, decompress is optimal for your health.
And does exercise and how does that factor into relieving stress? Because I hear, and I can vouch for, it can be a great stress reliever too.
Oh yeah, it releases endorphins in your body, the feel-good chemicals. So you have that good euphoric feeling after any type of exercise.
Chris Hedio, health coach, Mon Health Heart and Vascular Center. Mary Lynne Withrow, Senior Nursing Director, Heart and Vascular Service Line. Chris, give us the specifics again for the Morgantown Heart Walk, the who, what, when, where.
It's June 17th. Registration is at 9:30 in the morning, 10 o'clock start time. You can go to monhealth.com/heart, or you can visit the Greater Morgantown Heart Walk site at www.heart.org.
Chris Hedio, health coach, Mon Health Heart and Vascular Center. Mary Lynne Withrow, Senior Nursing Director. Guys, thank you so much for coming on and spending some time with us this morning. And we're looking forward to the Health Walk coming up, or the Heart Walk coming up on June 17th. Thank you so much.
Thanks, Dave.